Welcome back to Talk Living. Now, Lowry has survived her coughing fit,
Oh, yeah,
so she's still with us. I never heard her so quiet, but
you won't hear it again.
I'm enjoying it. So, if you want
You've become
to,
power mad, aren't you?
if you want to find out a host of useful information, you can always visit our website, bodyandbalance.tv. But right now, we're live in the studio talking to psychologist Dr. Gehl. Now, a question for you is: people tend to think that eating disorders affect just individuals, but they can really tear families apart, can't they?
Absolutely. It's not something that's solitary that just affects the individual. It's going to impact the whole family. I think the attitudes that a family displays around food, mom and dad, how they're handling food, how they're relating with their own bodies, it's definitely going to have a huge impact on the rest of the family as well.
One of the questions we asked earlier was, can you catch obesity? Well, in a way, can you catch an eating disorder? Does it tend to run in families?
It does actually tend to run in families. I don't know about it being contagious, so to speak, but I think people's attitudes towards food do tend to rub off on each other.
Is this kind of learned behaviour?
Certainly.
I mean, when I get clients to come to see me as a nutritionist, the standard question I ask is, do you have an eating disorder? And if they happen to want to tell me the truth, they say, yes, I've got bulimia. And the next question is, anybody else in your family, and in particular your mother? And I find it really common. You have a bulimic young woman and you'll have a bulimic mother, and in some cases the mother has taught the daughter how to be bulimic. This is how you keep your weight down, darling, which I think is shocking.
Do you find that many people are forthcoming with you when they first come in?
Not always. It's very much their choice, but because on the whole they're paying large amounts of money to come and see me, so they need to get their money to it. So they might as well be honest, you know what I mean? Let's
get it out fast.
Absolutely. But no, I think a lot of people don't want to talk about it. I mean, Princess Diana talking about bulimia was a huge change, and people were very shocked at the time, of course. So it is more socially acceptable. But there's still a sort of judgmental attitude. Somebody on the production team, who I won't name, said rather sarcastically, well, you don't get people in the developing world with bulimia now, do you? So, assuming that it's some kind of indulgent Western disease.
Right.
What do you feel about that?
And that is the stereotype. That it's only sort of rich, upper middle class, white, young girls that suffer from anorexia and bulimia. And really it's much more prevalent than that. And it's an addiction, it's a coping mechanism, and it's something that people reach out for in a time of help, in a type of crisis.
And in terms of going back to school, I mean, is bullying quite a contributing factor to eating disorders?
It can be, but I don't think any more so than anything else, to be honest. I think one person can handle bullying quite well and just sort of have it like water off a duck's back, and somebody else can take it to heart and
because Laura,
be
you had an
crippled.
experience with it, didn't you?
When I was a teenager, when I kind of began to be, when I went to my first big diet, it was as a result of being bullied. And I think back then, at age 14, I did think, well, if I lose weight, I'll be more popular. But then it became about much more than that. And I think maybe it was always, but that certainly kicked things off, absolutely.
And bullying might make someone a bit more aware of their body. It might make them be aware that they want to start a diet, but it's certainly not going to put somebody who is otherwise healthy and otherwise balanced, not going to all of a sudden give them an eating disorder.
But do you think also at school, if one of the friends is obviously looking very thin due to an eating disorder, do you think that influences their friends to do the same thing?
There is a peer pressure, isn't there, in terms of weight loss, or there can be?
There can certainly be a peer pressure in terms of weight loss. A lot of anorexic and bulimic people can be competitive as to who's the best anorexic and the most sick bulimic.
That's amazing.
I mean, all the websites now, the Pro-Ana websites, where they do kind of trade tips on how to
they're
withhold.
Horrific, with images of very, very skeletal women and sometimes very, very dangerous tips. For people to lose weight.
When you're helping people with an eating disorder like anorexia, how easy is it? Or I mean, because the experience I've had with anorexics, and I have a family friend whose daughter was anorexic, and she was incredibly willful, and she went in and out, in and out. She'd go into hospital, she'd gain enough weight to get out of hospital, come out of hospital, and immediately lose the weight again. And this went on for years and years. Is that your experience?
I think it can be with some people, and I think for a person to have a successful treatment, they have to really be self-motivated. There's nothing that you can do to force someone into treatment. There's nothing you can force someone to... Well, you can put them into treatment, but as you said, they will gain the weight and then lose it again if they're very attached to their eating disorder.
If someone has an eating disorder and they want to go through the NHS, I mean, how long does it take for someone to be able to see a psychotherapist?
I mean, it depends on where you're located and which trust you fall within, but I know in some cases it can be up to 6 months in the NHS.
That's incredible, isn't it?
Which,
It's
when,
shocking.
you know, when it's a potentially life-threatening condition, 6 months is a long time, isn't it? You can lose a lot of weight in that time. Well, the good news is that you can recover from all of these conditions.
Absolutely.
In a moment, we're going to talk about the kind of treatments available, and if you are a member of a family with somebody with an eating disorder, stay with us because we've kind of got a kind of more hopeful side to what intervention you should make, how to help the person in your life who does need the help.
Lots of different therapies, cognitive, behavioural and family therapies. But again, you know, we want to hear your stories, so please text us to 87474. We're going to be right back, so